Now let's talk about schizophrenia. In the DSM-4, schizophrenia had 5 subtypes, and these were dependent on a combination of symptoms. In the DSM-5, they've recognized that many people didn't actually have their symptoms in the particular combination that were being prescribed, and so they have removed the subtypes and simply called it a spectrum disorder, where clinicians can identify the particular symptoms and the severity of the symptoms based on each individual case. The symptoms of schizophrenia must continue for a period of 6 months or longer. If you do not have 6 months of symptoms, then you have a schizophreniform disorder or some other form of psychosis. And if the symptoms are combined with emotional or mood disorder type symptoms, then we would call that a schizoaffective disorder. Schizo being the effects of schizophrenia, and affect, as we talked about earlier, referring to mood symptoms. Schizophrenia symptoms then are broken into the following categories, and this is a very quick summation of them here. The first are the delusions and hallucinations, and these are usually auditory and they're often persecutory. In other words, the person often perceives that these particular hallucinations are often telling them to do things and may not necessarily be friends. The person may also have emotional effects, particularly in the form of what we call a flat affect. And when a person has a flat affect, they're going to not display the normal range of emotion. They're going to have a lack of volition, and volition simply means the drive to act on one's own initiative. In other words, a person may, for example, get up and go to work, or get out of bed, or take care of oneself. This is a person who has an emotional detachment and some form of social discomfort, a disengagement from other people. Later on, when we talk about the personality disorders, we're going to talk about schizotypal and schizoid. And in those type of personality disorders, you'll also see this particular aspect, this social disengagement or discomfort with having relationships with other people. The other one we want to talk about is disorganization. And disorganization is manifested in a variety of ways. The person is going to have disorganized speech in some cases. And here's where an individual may speak in ways that are heavily derailed. They seem to not be making any sense. Sometimes people refer to these as word salads, where people are making all kinds of erratic statements, laughing at themselves, or speaking in tones that are emotionally very labile. They're going up and down and all over the place. The individual's thinking is probably also disorganized when they're showing you that speech, but even if they aren't, they may have disorganized thinking, which means that their thoughts are just as erratic and disorganized, going in a variety of different directions. And their behavior may similarly be disorganized. The person may pace aimlessly. The person may not be able to get through sort of the normal structured activities of their day, such as their hygiene or their feeding and so forth. And when we think about people who are homeless and schizophrenic, they probably are experiencing this symptom. They may have had tremendous difficulty in keeping abreast of or keeping on top of their day-to-day life functions. Some people actually have what we call catatonia, and we talked about this earlier, and this can exist as either stupor, where a person sits sort of blank-faced, open-mouthed, and seemingly impassive and unresponsive to stimuli from others, or it may exist as motor agitation or excitement, and these things can happen in combination. The person may have this waxy catalepsy we spoke of earlier, where we can perhaps move them into a particular position and they will stay there for a period of time. They may have echolalia, which, remember, was a symptom we also described of being a part of autistic spectrum disorder, and this is where a person may repeat things that others say, and they aren't necessarily repeating everything that others say. They may repeat just the last sentence of a conversation that somebody has had with them, or the last word, or even in some cases a syllable. And sometimes this echolalia can be quite delayed. The person says something sometimes minutes or hours later. It reflects a repetition of something else another person has said to them. And echopraxia is not entirely different. Echopraxia refers to the echoing of the behavior of others. The person mimics what other people do. And again, these are not intentional or attention-seeking behaviors. They seem to be autonomic or automatic. The person isn't necessarily even aware that they're doing them. But the thing we need to remember is that these symptoms may be mixed. In the old DSM, these particular symptoms we have above here were often considered to be grouped into particular subtypes, particularly the delusional and hallucinatory was referred to as the paranoid type, the flat affect and disorganization was the disorganized type, and the catatonia was considered the catatonic type. But there was a mixed type as well, and the mixed type was for anybody who really didn't fit into the other three. And there was also a residual type, and we'll speak more about that in a moment. So the severity may fluctuate for an individual in terms of their schizophrenic symptoms. People can go into remission, sometimes just because of the medications that they're using, and sometimes just as a function of what's going on in their lives. Their compensatory mechanisms work better in some circumstances than in others. Even when a person is effectively managing the symptoms of their schizophrenia through medications or other psychosocial interventions, they will normally have some residual effects, and this is what used to be called as the residual type. And this individual will seem, even to people who don't know their personal medical history, just a little bit socially awkward or odd, perhaps a bit more detached, or they seem perhaps like a person who is trying to think their way through a social engagement or through a task, as opposed to sort of going through it in a more habitual and conditioned way. Now let's turn our journals to depression. What is depression? How can you tell the difference between a sad or grieving person and someone who is depressed? Based on what you know, what are the central features of bipolar disorder? And as we said earlier, we should note that in the past, these disorders were all lumped together as mood disorders. But now, depression and bipolar disorder are considered to be separate categories. After journaling, we'll come back and take a look at the definitions of these two different types of diagnosis.